Welcome to PACU Nursing Minutes. My name is Nurse Cathy. I'm the founder of PACU Nursing Minutes, a new YouTube channel focused on perianesthesia nursing education. So this channel is for nurses who are new into the recovery room, or maybe you're a nurse who's considering transferring into the recovery room. Maybe you work in the ER or in the ICU. Well, this is your channel. And this channel is also for those nurses who are in the PACU and you're considering getting your CPAN certification. I hope you continue to tune in here as I'll go over some of those things that you'll want to review as you prepare for that course. And then this channel is also for those people who are going to be undergoing possibly an elective surgery here in the near future. Maybe you're going to have a knee replacement or cataract removal, or maybe your child needs to have a tonsillectomy and you just are wondering what to expect from your recovery room nurse. Well, I hope you continue to tune in to PACU Nursing Minutes. So why did I start this channel? Some of my peer nurses out there may ask. And it's something that I've been thinking about doing for over a year. I've been in the recovery room for a little over 4 years. And when I first entered into the PACU, the hospital that I worked at, we did not have a nurse educator, and I was given a big binder and told to read this, do the competencies, sign them off and hand them in. And so I really had to be a self-learner, and I leaned on my preceptors, senior nurses in the PACU, and talked to my anesthesiologists and just did a lot of reading on my own. After I'd been there a couple of years, I did get my CPAN certification, and that is where I just really noticed there was a need for education, focusing on hands-on things that you need to know in the recovery room. I used to teach, and I just have a real passion for that, and I wanted to hand down to the next generation of nurses the knowledge that I've gained over the years. And so that's how PACU Nursing Minutes was born, a venue for knowledge sharing. So topics that I will be covering on PACU Nursing Minutes will cover from ambulatory surgery procedures like a meniscectomy or a cataract removal or a tonsillectomy, to like inpatient procedures like a TAVR or a craniotomy or a ruptured appendix. So just some of the bread and butter of what we do in the perianesthesia world. And then I'll also go over anesthesia modalities and what you need to know about those drugs post-op. And so you can really hone in on the recovery needs, and we'll cover those common side effects of anesthesia. And I also sprinkle in some evidence-based practice, because I always believe that what we do should be based on evidence so that we give our patients the best care possible and that we minimize waste and are really efficient with our time. And then talking about time, I want to keep it to a 10-minute segment. I know we're all really busy these days. A lot of you moms out there are not only working full-time, but you're also homeschooling your kids. You don't have a lot of time to give to education, so I want you to give you something that's valuable that you can use today in your practice. So a little bit about me. My name is Nurse Cathy, and I live in the Pacific Northwest. Some of you may recognize this volcano right off the bat. It's Mount Baker, and I live in that area, and I practice there. And my husband and I originally am from the East Coast, but I came to the West Coast in 2003, and I got into enjoying the mountains and mountaineering. And in 2011, my husband and I, we actually summited Mount Baker along the Sauk Glacier, and then up to the Roman Wall, and then on up to the crater. So it is just stunning up there. You can see into the Canadian Rockies, out to the Pacific and the San Juan Islands, and into the central North Cascades, which is just stunning. So if you get a chance, you've got to come up here and check it all out. So more about me. I've been in nursing as long as I can imagine. I started out as a CNA at 15, went to a vocational technical high school and got my licensed practical nursing diploma when I was 17. Then I went right to college to work on my BSN at Newman University, just south of Philadelphia, kind of on the Pennsylvania-Delaware line, and worked all through college as an LPN. And then once I got my BSN, I went right into the hospital setting, acute care setting, into a critical care nurse internship program at Christiana Hospital in Wilmington, Delaware, which is a level 1 trauma center. And that was really the best thing I could have ever done for my career, was to get into that critical care nurse internship program, because it really gave me the foundation for what I needed for the rest of my career. And I just want to take a moment and say thank you to the nurses in the medical ICU. Paula, Jan, Udell, Debbie, Critter, Val, Cathy Johnson, Dr. Z. I know a lot of you have retired, but I just want to say thank you. You really poured into me when I was a baby nurse, and I will never forget those years. It really was invaluable, and I recall on those days many times, especially when I'm challenged. So thank you so much, and enjoy your retirement. I hope to be maybe about 15 years behind you on retiring. And, I hope that this channel, I'll be able to pour into those baby nurses the way you guys did me, sharing my knowledge that I've learned over the last 20 years now. So after working at Christiana, I spent 3 years there, and then I started travel nursing and spread my wings and went to the Bay Area, to Oakland, for my first ICU contract. And I bumped all around the Bay Area and down to San Diego, and then I went over to Philadelphia and Baltimore, returned to the East Coast for 1 year when my sister had her son, my nephew, and gosh, who is now going to be driving. And so then from there, I really missed the West Coast, and I returned to actually Seattle, and then back to the Bay Area, and I worked at CPMC, and I was in their cardiac ICU there, and we were implementing therapeutic hypothermia after cardiac arrest, which is now called targeted temperature management. And while I was there, I got to implement the therapy, and then I actually had the opportunity to become a clinical educator for the Arctic Sun. And so I moved into the educator role and spent about 3 years in that role, training up the hospitals along the West Coast in that modality. So some of you may recognize me from my days of when I was doing in-servicing in your ICUs with the Arctic Sun. So once the Lord closed that door, he opened up another one, and I returned back to the bedside at Tacoma General in their interventional radiology department, working in their neuro IR suite and their body IR suite, and which was really great because I got to use my ICU background. And I also got to just really learn a lot more about what goes on in the procedure world. And I got to assist with like carotid stenting and cerebral angiograms. And then I also got to, assist anesthesia with implementing, like intubation and general anesthesia for like a cerebral embolectomy for embolic strokes. So I learned a lot there, and I was really thankful to have been able to work with that fabulous team down at Tacoma General. And so my life took a little turn of a change after working there, and I got married, I had kids, and then I decided to go into the recovery room at that time because it really fit the best balance between work and home life. And I was also able to really pull on my ICU background when we do have those critically ill patients. But then I also get the joy of working with really healthy people who are just there for elective procedures. So it's a really nice balance of, med surg and ICU all in one. And so that's why I'm in the recovery room. And so personally, I am married. I've been married for 10 years now, and we have 2 sons, a 5-year-old and an 8-year-old. And like all of you in America, we are homeschooling. So credits, I always want to give credit to where credit is due, and the music on the intro and takeout is by Atch, and the song is called Freedom. So check them out. They got some really good tunes. And then disclaimer for PACU Nursing Minutes. This is a venue for entertainment and for knowledge sharing. Always follow your physician's orders, your hospital's policy and procedures, and your nurse practice acts in your states. And PACU Nursing Minutes is free of any legal liability. So if you like what you see here today, please subscribe, like PACU Nursing Minutes, and ring the bell so that you don't miss any of my weekly releases. And again, thank you for tuning in to PACU Nursing Minutes.